Hi there, I'm BevVan Phillips with Total Home Access Solutions, and I'm here today with Jack Pietenpole from Diabetic Outreach. Hi, Jack.
Hi, BevVan. Nice to meet you.
Nice
but
to
I
meet
have
you.
to ask you, what are you wearing on your feet?
Oh, these? Well, you said we were going to be talking about comfortable and conforming shoes.
Yes, but not those.
Well, Jack, here's the most important question. How important are shoes to the quality of life?
Shoes are very important. They play a pivotal role in balance issues, in mobility for diabetics, because the best exercise a diabetic can do is walking. And if a diabetic's feet are hurting or causing problems, they're not going to want to walk. So shoes are very important for mobility issues.
And I guess it matters that the shoe fits well, right?
That is correct. Your shoes should always be measured whenever you go to a shoe store to do the fitting, and if at all possible, the best time of day to fit shoes is later in the afternoon, because no matter how healthy we are, all of our feet tend to swell a little bit as the day goes on.
Well, that's a good tip. That's a good tip. I got to tell you though, I work with a lot of people who look like they're wearing shoes from 1972. Do shoes really last that long?
No, it's a myth, and I've run across a lot of people that are proud to tell me that they've had their shoes 5, 6, 7, or 8 years. And cosmetically, the shoes may look good on the outside, and I use the analogy of an automobile. If you wax it, keep it ding-free, it looks great on the outside, but underneath the engine is where all the wear and tear takes place. Same thing with the shoe. Cosmetically, on the outside, it may be clean, it's scuff-free, but the inside of the shoe, where it provides the support, over time, the sweat and bacteria and the constant pounding of your body tends to wear down the parts of the shoe that provide the support and stability. So shoes do not last forever. Most shoes, if you wear them 7 days a week, are probably made to last at the most 18 months.
18 months. So you're investing in good shoes every now and again to make sure that you work properly, right?
Yes, and if at all possible, you'd like to have more than one pair of shoes so that you can switch out during the week to allow that one pair of shoes to tend to air out and dry out so that they don't break down as easily.
Okay. So what makes the shoe different, or the engine of the shoe? I like that analogy. What makes that different than a shoe somebody would just go somewhere and buy?
Well, there's a lot of different things that go into making footwear. The footwear that we deal with is therapeutic footwear that anybody can wear for being comfortable,
okay,
and support issues, and also depth issues. We do have some patients that have foot deformities that maybe a deeper shoe would be more practical and a little bit more comfortable for them.
Okay. Well, now I've heard that it's very interesting to work with you. If somebody calls up and they make an appointment with you, what should they expect to happen through the process?
Well, what's going to happen is we're going to screen them to make an appointment. Then they'll come into the office. My evaluation is going to take anywhere from 15 to 30 minutes. We're going to discuss what are some of the goals of the patient, how ambulatory are they, what type of footwear they're looking for, and what is the footwear going to be used for, and then we'll determine what shoe would best fit their needs.
So just like I walk into a house and I will prescribe a certain location for grab bars or a certain dimension of doorway modification based on what a person is needing, you're actually prescribing shoes and what's inside the shoe to match a person's foot.
Correct.
Wow.
Yeah, and there are a lot of different styles of shoes out there for a lot of different reasons. Some of the shoes, for instance, this would maybe be a casual dress shoe. This shoe doesn't offer a whole lot of support. So the patient that is looking for a lot of support, does a lot of walking and things of this nature, this shoe really wouldn't fit the bill for them. Also on the bottom of the shoe, we have what I call an hourglass figure. of the shoe. And we don't have 100% contact of the sole of the shoe with the ground. So there's also a stability issue maybe with this shoe here versus this shoe right here, which is an athletic walking shoe. The best shoe that an individual can wear on their feet during the day is a tennis shoe. Most of those shoes are built for shock absorption and stability. Now we see on the sole of this shoe is a lot different. We have 100% contact with the ground with the sole of the shoe to provide support and stability. This is also a leather shoe, which is going to be a lot more durable for any type of inclement weather that we may have. Now this is a tie shoe. Some of our patients, a lot of them may have arthritic conditions or the inability to reach down and tie a shoe. So a lot of our shoes will also offer Velcro closures. The main thing you want to make sure with your shoe that you secure it to your foot. This is not a slipper and it's not a flip-flop. Again, this shoe here, 100% contact with the ground, is a leather athletic shoe, but it does serve the same purpose except it has a Velcro closure.
Well, these are pretty fantastic shoes with a really fantastic benefit for people. I know that people might say, well, do they come with a fantastic price?
Well, as the old adage says, you're going to get what you pay for. Our shoes are normally priced with whatever you might find out in the public. But also Medicare, Medicaid, and some private insurances will pay footwear once a year, especially if you're a diabetic. The criteria Medicare, Medicaid, and the insurance companies has established is certain things going on with the feet. That's where my job comes in, where we will qualify your feet to meet those standards. After we have qualified your feet, what we will do is we'll send that paperwork to your doctor. And this has to be your family doctor, general practitioner, whatever the case may be. Your physician has to approve the footwear. Medicare and Medicaid allow for this one pair of shoes every calendar year. So in most instances, there is little to no out-of-pocket expense for our patients.
Wow. That is fantastic. I want you guys to share this news and share the video. It's important to work on balance in your home and mobility in your home, and I'll be glad to help you with that. But we also need to take care of the fact that you're walking on feet. Call Dr. Jack here and let him make sure that you're walking on good shoes with great support, right?
Exactly.
And
yes.
how do people find you?
Well, we're at 1941 K Street here in Lincoln. Our phone number is 402-477-1110. And we also offer in-home appointments for our patients where mobility and transportation could be an issue.
That's great. Thank you very much.
Thank you.